All right, I think now is a good time to start. Welcome everyone. Thank you for being here for this virtual activity, kind of discussing some of the health career pathways through Sonoma State University. We are here live with our two panelists, Dr. Joseph Lin and Dr. Stephen Winter from SSU, and Ms. Moran's biomed class, I believe, right? Was it biomed? Did I say that?
Yep. Biomedical, okay. Yeah.
And so what we're going to do here today is we're going to have a little bit of a presentation from Dr. Lin and Dr. Winter about their respective focuses at Sonoma State University. And we're really going to just kind of highlight some of the career path opportunities through Sonoma State University. And then we will kick into some good Q&A from the students. So my name is Brandon Jewell. I'm with the CTE Foundation. I'll be hosting this today. If you are watching live on YouTube, I will be tracking the YouTube chat. So you're welcome to ask some questions in the YouTube chat. And when it's a good time, I'll ask that of our panelists. Dr. Stephen Winter here is a kinesiology professor and the department chair. And then Dr. Joseph Lin is a biology professor. And we are going to, I think, start it off with you, Dr. Winter, if you want to start talking about the kinesiology program.
All right, thank you. So thank you, Mr. Jewell and Ms. Moran. Let me switch over to my screen. And if this is okay, is that showing up all right, even with the little side view?
Yep.
So I have been at Sonoma State University for 33 years. Love it. Really enjoy this institution and the small class sizes we have with students versus the universities I attended, where there were hundreds upon hundreds of people in a classroom. So I really enjoy working with students. Kinesiology. Kines means kinetic movement. So the study of movement is what we are. And when I came here 33 years ago, 80 to 90% of our students were going into becoming physical education teachers. Now that's a very small part of what we do. Is kinesiology for most people is a pathway to go on to different healthcare fields. What I like to call paramedical fields. Dr. Lin will talk about pathways to medical doctor, dental, veterinary, but these paramedical fields. And what we have is 3 different degree programs. It's a Bachelor of Science. Exercise science is mostly for people that want to go into things like physical therapy, chiropractic, physician assistant. We have an interdisciplinary concentration that we develop very specifically for pre-occupational therapy. And then our lifetime physical activity concentration is for people that are going into the health and fitness areas. I want to be a personal fitness trainer. I want to be a strength and conditioning coach. So we have that 3rd pathway. And if I go to a little different thing, and it's very busy in a lot of things, but on the right side, it names some of those career opportunities and some other career opportunities that I just don't have the time to mention. But I always put this slide up as the 2nd slide because one of the important things to me at a university is getting involved. So there's the coursework you take, but there's being involved. And being involved, some of the department activities that are listed on the left side there are the things that really prepare you for a future career. And it's being involved and getting that hands-on experience that builds your resume. So when you try to go to a postgraduate school to become a physical therapist, or you're looking for your first job and they say, okay, tell us what you've done. And you say, I have a degree. Well, that is wonderful. There's a large percentage of the population that doesn't have a college degree. So that is something to be celebrated. but everybody else applying for that job or position or that professional school also has that college degree. So they want to know, how have you applied yourself? What have you done? So a very important aspect of the kinesiology program at Sonoma State is not just giving you coursework, but giving you the hands-on experience to go on to the next step of your life. And I only have a couple minutes, so let me just quickly go through the other slides. But after talking about experience and looping back to classrooms, this is what we would have you take as a freshman or sophomore. You're taking biology, you're taking chemistry, you're taking statistics, and then your sophomore year, you're taking human anatomy, human physiology. Well, a lot of these classes, you could take variants of them in high school. So taking these classes in high school, because I believe Ms. Moran's class is mostly freshmen, sophomores, these are courses you could look at in high school to prepare you to go into healthcare professions and to hit the ground running when you get to college, whether it's Sonoma State or some other institution. We have core courses, so no matter which concentration you pick, we have these core courses. And what we do is, since we're the study of movement, we look at movements from many different aspects. We look at movement from, I'll just go backwards from the bottom up. How do you develop skills? How do you learn how to throw a ball? How do you lose skills? When we get older and our eyesight, I didn't used to wear glasses. As our eyesight starts to go, how does that affect our movement abilities? Physiology of exercise. What's happening at the cellular and organelle level that allows us to exercise cardiovascularly and musculoskeletally? Biomechanics is describing movement in terms of how movement occurs, in terms of mathematically describing it. Nutrition, how do we fuel the body to move? And then the last two courses, going from the bottom up, is, okay, that's all the human body, but what's happening in our mind? What keeps us from exercising or not exercising? Are we scared to try a skill because we fear failing in front of people? Or are we the go-getter, like, I don't care, I'm just gonna try it anyway, So what's the psychological aspects behind movement? And then where does movement fall historically and sociologically, considering race issues, gender issues, all sorts of other factors? So we really look at movement holistically. And to wrap this up, this is what professional schools are looking for. No matter what kind of aspect of healthcare you want to go into, whether it's physical therapy, physician assistant, occupational therapy, chiropractor, I want to be an X-ray technician, I want to be a strength and conditioning coach. All those things, you're working with a human person. That's not only a body of functioning machines, but their mind and their psychology. And the kinesiology department is designed to help prepare you for those career paths. Let me stop the share there.
Thank you.
But any questions, any things I can answer?
Yeah, so I'd love to offer up the students to feel free to, if you did fill out a photo release form, feel free to unmute and turn your camera on, and you're welcome to ask any questions of Dr. Winter. If you didn't turn down a photo release form, you're welcome to unmute and ask it, but maybe just don't turn your camera on.
Can I ask a question?
Yes, please, James.
I'll turn on my camera on. Let's see. Okay. How long did it take you to learn everything that you needed to learn?
So thank you, James. It depends on the career you're going for. A lot of careers now, and Dr. Lynn will talk about this also, is a lot of the healthcare careers now are post-baccalaureate. So you get your 4-year college degree, and then you need to go to another 2 or 3 years of school after your 4-year college degree. So you're probably looking at 7 years after high school. There's other career fields. It's kind of funny, but the career people go into, it's actually an Associate of Arts degree at a community college. So it sounds funny to get a 4-year degree to become, say, a radiology technician. But what you will see is the radiology technicians that make the best salaries and the radiology technicians that can move into management positions are ones that have a 4-year college degree. So we see a lot of students that they come to us from the JC, they're already a registered radiology technician, and they come to Sonoma State for the last 2 years to get that kinesiology degree that gives them better job opportunities, higher paying jobs. And in that case, it takes 4 years.
Thank you.
Yeah, thank you. That was a good question. Do we have any others? Okay.
What does your typical day look like?
So I'm sorry, I didn't hear who asked that question. So sorry, I'm not addressing you directly. But a typical day as a professor, or a typical day as, name a career for me, and I'd be happy to kind of answer that.
Just like your typical day, like what you do on the day.
Oh, okay. I mean, my typical day pre-pandemic is as a teacher and an educator. So, so as a teacher and an educator, part of my day is in the classroom interacting with students. And the other part of my day, honestly, as a department chair is paperwork. and that's what I do. Prior to becoming an educator, and I've been doing that for 33 years, I was a certified athletic trainer. And my day was working with intercollegiate athletic teams at UCLA, at Santa Barbara City College. So my whole day was getting athletes, student athletes, ready for practice, rehabbing student athletes that had had injuries, and being available to evaluate and do emergency treatment on athletes that unfortunately did get injured during practice or contests. So that was my previous life before becoming an educator. And I think that was Brianna, so thank you.
Yeah, the question about what you do on a every day is going to be different as the educator versus one in the careers of some sort of kinesiology path.
Right.
So those are some great questions. Thank you all very much. What I'd like to do is move it over now to Dr. Joseph Lin, and then any additional questions we can ask later during the Q&A part. But Dr. Joseph Lin is you're with the pre-health side of things, and that's more like med school, dentistry, optometry, pharmacy, stuff like that. Am I correct?
Yeah. So thank you for having me. While I'm a professor of biology at Sonoma State, one of the other hats I wear is that I'm the chair of the advisory program. So, part of me, yes, I teach all the biology classes that you think a normal professor does. But one of the other roles that I have is I meet with a lot of students one-on-one to basically advise them during their time at Sonoma State. And I make sure that they take the appropriate classes that they need so that then they are eligible to apply to typically medical school, dental school, veterinary medicine, podiatry, optometry, basically all of the professions that you think of as being health related, except for physical therapy. And that's where Dr. Winter comes in, and nursing. We have a separate department of nursing that talks to students interested in nursing. And so, I don't want to spend too much time talking a lot about the details of Sonoma State, because I think a lot of students just want some general information. Obviously, if you do end up coming to Sonoma State, I meet up with students one-on-one, from the time they first arrive on campus, and I stay in touch with them throughout their entire time to make sure they're on track. And the part of the reason we do this is because it doesn't matter what major you are, if your interest is pursuing health professions. So what I mean by that, if you want to go to medical school, you could be a history major, you could be an art major, you could be an English major. You don't have to be a typical biology major. And that's kind of where I wanted to start this kind of presentation, is that you don't have to be a science major, such as biology or biochemistry, to be a strong applicant. And this is important. I think when kids go to college, it's important to have an idea of what you want, but I always encourage students to major in whatever they're passionate about. Don't get fixated on thinking, oh, I need to be this major because it's going to look good for medical school or veterinary school. Major in what you care about. And if what you care about happens to be biology or biochemistry, by all means, major in that. But I think college is a place to really take a lot of different classes, broaden your horizons, and not do things because you think it looks good. Do things because you care about them, and do things because you're passionate about them. And you'll see that passion will come through. We've had students who were music majors apply to medical school, students who are psychology majors apply to medical school, and many of them are very successful. So don't think you have to always follow this very prescribed path. The other kind of thing I would mention is that grades and test scores are really, really important, but they are not the only thing that these health programs will look at, right? If you have a 4.0 in college and you have really high standardized test scores, that's great. It will be easier for somebody like that to get into medical school and whatnot, but that is no guarantee. Because these days, medical schools, veterinary schools, all of these, dental programs, they're so incredibly competitive that they're looking for more beyond that. And that's, again, kind of tied into the advice I want to give you guys in terms of these programs look for two important things. One, that you can handle the curriculum, right? Once you get into medical school, are you going to be able to make it through all the classes? And that's why having good grades in college and good standardized test scores matter. But the other thing that's really important is they want to make sure you know what you're getting yourself into. So the other half of this equation is they want to see you shadow, right? They want to see you volunteer. They want to see you work in the field that you are trying to pursue. So for example, if you want to go into dentistry, you have better be able to show them that you've worked with dentists in some way, or you've seen what they do on a day-to-day basis, because sometimes what you think they do isn't actually what they really do day to day. So make sure, even in high school, start thinking about what sort of things you see yourself doing day in, day out, right? I think a lot of people know about being a physician or being a nurse or being a dentist, but really start thinking, is that something you see yourself doing every day, right? And that sometimes if you see it on TV, that might not really be what it's like in real life. So I would encourage you, it's never too early to start trying to get exposure to some of the things you want to do. In college, it's going to be much more important that you document these sorts of experiences, but that's kind of the other side of the equation, right? Being able to handle the curriculum, but then making sure that you really know what you're getting yourself into, okay? And then part of that whole process, though, is that there are so many people that want to go into these health professions. What's unique about you, right? And this is where your personal experiences come into play, right? Were there certain challenges that you faced that most people didn't have to face, right? Are there certain accomplishments that you have that other people don't have? How are you going to make yourself stand out? And that's where, don't forget about pursuing the things you care about beyond just school, right? If that's volunteering at the local food bank, or if that is, playing sports and whatnot, those are all really important aspects of being kind of a well-rounded person, because health professions programs aren't looking for robotic people with just really good grades. They're looking for good people that have a wealth of different experiences out there. Okay, because again, always keep in the back of your mind, why would a program want you over all the thousands of other people applying to these programs, right? So this is the sort of thing that I think, always keep this in the back of your mind. Again, you guys are early on, so in high school, these are important, but even in college, it's important to keep these things up. Be well-rounded, right? Have good life experiences. If you are working, think about how those job skills that you have could apply to a career in the health professions, right? I think when I talk to students, I remember I met with a student who worked as a manager at Ross, and she's like, well, medical schools won't care about that sort of stuff. And I said, look, if you're a manager, you have to deal with people, right? You have to be organized. You have to interact with the general public. And that's what physicians do all the time, right? And so don't underestimate those sorts of life skills that you accumulate along the way, right? So people skills, and then other things like sports, right? If you are a college athlete, that's actually really attractive on a professional school application, because number one, it shows that you have good time management skills, right? If you're trying to balance multiple different things, it says a lot about you, especially if you were successful at the college level. Okay. And then the last thing here is like on your application, saying something isn't as powerful as demonstrating something, right? And what I mean by that is saying, oh, I care about people. That's great. I think most people would say that. What have you done to show that, right? So that's where if you volunteered for different programs, that is evidence that you care about people rather than just saying it, right? So these are all things to just keep in mind as you kind of transition through high school and ultimately to college is, you know, follow your passions, be well-rounded. And then, you know, once you get into college, make sure you contact the appropriate people to make sure you get the guidance you need, because the health professions track is a long track. I think Dr. Winter mentioned after you graduate college, some of these programs are 2 years, some of these are 3 years. Some of these are almost a decade long, right? You go to medical school, that's 4 years. Then you do a residency, and that's anywhere from 3 years to 7 years in some cases. So it could be a long-term, you know, long-term goal here. So make sure you get the help that you need along the way. Okay. Happy to take questions.
Great. Before we go into questions, I just want to say, you know, when you were talking, I learned that you don't have to be a science major to really go into medical school. I kind of figured you did. I mean, that's my ignorance not having been a part of that world, but I think that's such valuable advice. And I do also want to point out one more thing that you said that really sticks with me is that, you know, joining the health industry is just like any other job where you have to show what makes you special, and you have to show that you have a good personality and good communication skills. And just like on your slide right here, you know, you've got somebody serving. I've heard from multiple different business owners from different industries that if somebody has serving experience or customer service experience, even just working retail or something like that, they actually value those baseline jobs that maybe the average person doesn't think is all that valuable. They actually think that they're incredibly valuable because of those core, what's generally called soft skills that you would get in one of those jobs. The ability, like you said, to just talk to people and to you know, do your job with a smile and communicate well. I mean, that's so very, very critical. Yeah, so with that said, I'd love to open it up to questions. You know, on my list, I had Brianna, that you had a question, but I know you asked one before. So do you want to ask another one now, or was that your question that you wanted to ask previously?
No, I actually have another question.
Yeah, please.
So what like part of healthcare industry needs like the most people like for workers right now?
So I will say a lot of the healthcare professions are always looking for people. And there are some, so there's some things to be conscious of when you don't go into the healthcare field, in that, you know, they're long-term investments, right? You're looking at being in school for a very long time, but the job market is very good when you come out. And so that's where it's a little bit challenging. Sometimes you say, okay, you know, do I want to spend all this time in school? Keep in mind that when, you know, for example, after you finish medical school and your residency, you're going to always be able to find a job. There's such a shortage of most types of healthcare providers that the job markets for all these things are going to be good. Yes, there are a few places, you know, especially desirable places to live. Like, for example, brand new nursing graduates might not be able to find their dream job in San Francisco because there's so many people in the area, but at the same time, you will always be able to get a job, right? It might not be your dream job in the dream location at that time, but, you know, especially something like nursing, the ability to get jobs is a lot of times very driven on seniority. So recent graduates aren't going to have the priority that somebody who's been practicing for 10, 20 years are. So, you know, it's a good peace of mind to say you will always be able to get a job. It just might not be your dream job at the dream place when you first graduate. But yeah, I mean, they're long-term investments. The biggest downside, honestly, to the health professions right now is the cost of that education. The vast majority of people that go to medical school take out substantial loans. And the average right now is a medical school graduate owes about $200,000 in debt. And so that is probably the biggest downside. But at the same time, your earning potential is going to be pretty high, so you're going to be able to pay off that debt fairly quickly. There's a question in the chat box. Do you want me to address that?
Yeah, actually, you know, it's funny. I was just saying that, and I realized I was on mute. So yes, please address the question in the chat.
Yeah, so nursing is an interesting program. So nursing at Sonoma State is different than nursing at the JC. So the interesting thing and the challenging thing about nursing is there are many levels of nursing. For example, you can be a nurse by going to the junior college program, getting an associate's degree, and then you can just get a job as a nurse. You can also become a nurse by going to a four-year university, getting a bachelor's in nursing. That's called BSN, Bachelor's of Science in Nursing. And then you can get a job as a nurse. So the difference is the level of degree, the years of training, but they both can be your practicing nurse at, you know, a hospital or a clinic or a doctor's office. But you can also continue on in nursing. You can get a master's level nursing degree. These are typically called nurse practitioners, family nurse practitioners. And this is a master's degree. So after a four-year college bachelor's degree, then you would typically go on for another 2 years to get a master's degree. And it's a higher level nursing degree. It gives you more freedom, more flexibility. You have a little bit more independence because you have more training. You can even write some prescriptions as a nurse practitioner. And then there's also, you can get a doctorate in nursing as well. So there are multiple levels of nursing, and that's why there are different programs at different places. At the end of the day, each one of these levels is going to require you to take a board exam, and that board exam is going to be correlated to which level you're trying to attain.
And I was going to add, in terms of nursing, we see a lot of students come to the kinesiology department that originally wanted to be in the nursing program, whether at SRJC or Sonoma State, because they're so competitive to get into. And they loop back to the BSN, being a registered nurse, by doing an accelerated program. So they graduate from kinesiology, and then they take an accelerated program, which is a little different than the master's. It's not a higher level, but it would actually be what one would have taken at a junior, senior college level. And they become a BSN because they have their bachelor's in kinesiology. So like Dr. Lin was saying, there's many routes to do things, you know. So if nursing is what you really want to do and you don't get into a pre-nursing program and you don't get into a nursing program, there are ways to loop back to nursing and become a nurse. And literally 100% of our people that go through kinesiology and reapply to nursing programs, they all get in. You know, they all get in these accelerated programs because it really shows how bad they want it.
So I'm glad you chimed in, Dr. Winter, because I want, as we go forward with more questions, if there's nobody in particular you're asking it, we'll have maybe both panelists just give their answer if they want. But if you have a question for an individual, either Dr. Lin or Dr. Winter, please let us know which one you'd like to ask that question for. We have a couple of questions in the chat, but before we do that, I know that we still have a few others that have previously said they want to ask a question. So I'm going to go to a couple of those before we get to the chat. Michaela, did you have a question that you wanted to ask?
Yes, I would like to ask Dr. Lin, you said that you didn't need to major in biology to pursue a career in medicine. Can you please elaborate on that a bit more in terms of like schooling and career-wise?
Yeah, so medical schools are interesting in that one of the things that they actually strive for is they want a medical school class that has a wide range of experiences. And that's actually why they don't want just biology majors or biochemistry majors. They want the art majors, they want the history majors, because they bring in different life experiences, different priorities, and different ways of thinking about healthcare in general. So that's actually an attractive quality. If you're a non-traditional major, that's a bonus in some ways. The challenge, though, is that if you are not a biology major or a biochemistry major, one of the other criteria to get into medical school is the Mcat, which is the standardized testing. The standardized testing to get into medical school is all science, right? And so that's where, if you're not a science major, it's obviously a little bit more challenging because you've taken fewer science classes. But in order to meet the minimum requirements for medical school, you actually require very few science classes. You only require 1 year of biology, 1 year of chemistry, 1 year of organic chemistry, 1 year of physics, 1 year of English, and 1 year of math, and that's it, right? You don't need to take 3 years of upper division biology coursework to go to medical school. But at the same time, if you haven't taken those upper division coursework, you know, in biology or biochemistry, it makes the MCAT much more challenging. So that's kind of your trade-off. Your major, if it's not science, is actually beneficial in some ways, but you then have to make sure that you will still do well on their standardized testing.
Great, thank you. Good question. Hunter, I have you on our list. Do you have a question?
Yeah. Medical school has like built up this reputation of being very, very, very hard to get in, and then even harder to go through the program and keep high grades. Do you think it lives up to that reputation, or it's easier than people think it is?
The getting in is the challenge. The competitiveness to get in, once you get in, they're so competitive and selective that if you get in, you'll probably make it through, because the expectations of that applicant are so high that, you know, they are fairly confident that anyone they take will make it through the medical school program. But the competitiveness to get in is true. I can give you some numbers. So, you know, I talk to a lot of college students around here who want to go to the local programs like UC Davis or UCSF for medical school. And so on average, UCSF gets about 7,000 applicants. UC Davis is probably a little fewer, 6,500, depending on the year. And the class size at San Francisco is 140, 141. Davis is a little bit larger, about 150, I think. So you're looking at, you know, 140, 150 seats out of 7,000 something applicants. So it is very competitive to get in. But at the same time, we have had students from Sonoma State go to UCSF, and it's not uncommon.
I just want to point out that we are just a couple of minutes away from where we set an end time. So I want to check in with our panelists and Ms. Moran if we're okay to keep going a little bit over on time.
Sure, I'm okay if they are.
Okay, I just wanted to make sure it didn't cut into wherever your class was ending. Maybe let's get to some of the questions in the chat here. One of the questions from Nahida, which I think is a great question, is what do you think we can do right now in high school? I assume she means to prepare for what's to come in post-secondary and then the career after that. And that would be a question for both of you.
I haven't fielded anything for a little bit, so I'll go. I think what shocks some of our people is the science majors, if you go that route, are very vertical. You have to take a certain class your very first semester at Sonoma State so that you can take another class in the spring, so that you can take these classes in your sophomore year, so you can take, so you kind of get thrown right into the fire with a lot of these majors, whether kinesiology, biology, some of these other majors. So your very first year, you're taking biology classes, you're taking chemistry classes, you're taking mathematics classes. So the better you prepare in high school in those areas. Unfortunately, we get a lot of people that are interested in healthcare fields, and by the time they have to take a year-long series of chemistry or biology or even some physics in there, we lose a lot of students, you know, and they go, well, maybe these careers aren't for us because I just don't enjoy these science classes. So that might be something to explore in high school. You know, how do you do in these classes? Do you enjoy these classes? Are you looking forward to the opportunity of taking more chemistry and biology, physics in college to then get into the actual courses in the major where you get deeper into your passion and what you actually love about, in our case, kinesiology and movement.
Yeah, I would say my advice centers are, similar to what Dr. Winter's saying, but the other thing I would say it's really important, even in the high school level, start talking to people, right? Yeah. Talk to the people that do what you think you want to do. If you think you want to be a dentist, next time you go to the dentist's office, talk to your dentist. Ask him or her if they enjoy what they do. How did they decide to do what they want to do? The more information you gather at a younger age, the easier it is for you to put a plan together as you get older. And that, me growing up, my dad was a physician, and I remember I talked to him and talked to some of his friends. And I kind of made the decision that even though I always loved science, and I especially really was interested in medical science, that being an actual physician wasn't the right path for me. But you don't learn those things until you talk to people and kind of really see what's behind the curtain. Because I think a lot of times what you see on TV or you think isn't really what they do. When you talk to a physician and you think, oh, they get to talk to patients all day and get to really know them. What do doctors do most of the day? Paperwork.
So. That's a very important point. Like, I decided in high school whether I wanted to become an athletic trainer or a physical therapist. And that's exactly what I did. I talked to those people, eons ago, decades ago, but, and some of it's lifestyle. The physical therapist works 50 weeks a year and has a 2-week vacation, but you have a 9-to-5 job. I decided to become an athletic trainer where it's like, okay, you work late every night, you're covering athletic contests every weekend, but then you get 3 months off during the summer. Well, that fit with my lifestyle because I love going hiking and camping during the summer. So some of it's about the occupation, some of it's about what are the demands going to be on your personal life or family life in the future. And you're not going to know that without talking to a dentist, an athletic trainer, or a physical therapist. So yeah, very great advice, Dr. Lin.
So we're actually getting a lot of great questions in the chat here. We also have a good question on the chat on YouTube. I'm just going to ask that maybe to get to all the questions, we can kind of make this like more of a rapid fire round. I did want to, we still have a few students who've let me know that they have questions. So I'm going to call on a couple of them. Jaden, would you mind unmuting and asking whatever question you have?
Yeah, I have a question for either professor. How has technology impacted the health career?
You want to go, Stephen?
I think technology has, I've got a bias on that question. I think technology has helped us to provide better health care in the sense of assessing what the patient's problem is in terms of providing care to the patient. But I think in some of that, like any other industry where you involve technology, you lose some of the personal aspect. As Dr. Lin said, with all this technology, the physician is spending less time being that friend and caregiver to the patient and more of a practitioner. So it's a two-edged sword. We're taking better care of our patients, but are we losing out on the human aspect of taking care of patients, which is what I loved.
Yeah, and I would agree with that. There is a side of technology, though, in medicine, especially when it comes to diagnosing diseases, and especially, in this day and age with genomics, and you guys all hear about the 23andMe and getting genome sequences. That's a large part of medicine now, especially in the medical research world. And so that provides a lot more information that allows us to better understand the body. And so medical schools will definitely train you to kind of integrate yourself with the technology, but it moves very, very quickly.
We have a question from Aaron. Aaron, do you want to unmute and ask? No? Okay. Well, then we'll skip you, Aaron. And then we also had James. Now, James asked a question earlier. I don't know if that was the question, or do you want to unmute and ask another question, James?
I have another question.
Yeah, please.
So it's for Dr. Lin and Dr. Winter. Out of all of the opportunities and choices in the medical field, which would you say are like the most difficult to enter?
I mean, purely statistically, if you look at the competitiveness to get into programs, medical school leads the way there. The number of students that want to go to medical school versus the number of slots that they actually have is the most competitive if you just look at the numbers. It's also the longest training in terms of the amount of time it takes to get to the point where you're an independent practitioner.
Oh, I meant within the medical field, because there's like a lot of different ways
you
you can
mean
go from there.
Like subspecialties within medicine?
Yeah.
Same idea in terms of the ones that require really long training. So if you want to be a specialized surgeon, you're looking at least probably a 7-year residency after medical school. So that's 11 years with a fellowship to get even specialized. So you're probably looking at 12 to 13 years after college. And those are probably the most competitive things out there, you know, like your classic neurosurgeon or a transplant surgeon. Those are some very long training programs.
And I assume those are where you have the highest earning potential as well, though probably the largest loans.
Yeah, you know, at medical school you pay for, but then during a residency you're actually paid a decent salary, but not, you know, you're not getting rich as a resident. That and you have no time to actually live your life. So
great. I'm going to ask a question here from YouTube that says, can you describe the path to becoming a physician's assistant?
Yeah, so physician assistant is it's not a new path, but it's becoming more and more popular. And so a physician assistant is a master's level program. So typically you go to college, get your 4-year degree. And again, it can be in anything, but I would say the vast majority end up being in the sciences. And then from there, they're usually a master's program that is anywhere from 24 months to, depending on the program, 3 years. So 2 to 3 year program. And that these jobs are you're not independent, meaning that you still have to have oversight from a physician, but you can work independently. So the things you do then have to be signed off on by a physician, but you were taught many of the same things that a physician is taught. It just doesn't take as long because you don't have as much of the responsibilities that a full physician will have. So again, typically 2 to 3 years, post-bachelor's, then it's a master's. You come out with a master's in being a physician assistant. There are some local programs, one in Toro University in Vallejo, and then one at Dominican University in San Rafael, and then also in Oakland, Samuel Merritt.
We got a similar question in the chat here about how long the training takes to become a nurse, but I feel like you kind of went into that. Do you want to just maybe kind of re-summarize that for him real quick?
Yeah, it just depends on what level. You can, it can be as short as 2 years, but it can be as long as, 7+ years if you want to go that route. It just depends on at what level you see yourself being a nurse.
And then there's also a question for both of you to, could you real quickly just talk about what kind of education that you had to go through to get to where you are?
You want to go, Stephen?
Sure. So I originally was an athletic trainer, didn't know I was going to become an educator. So at that time, to become a athletic trainer that works with intercollegiate athletes at a university, it was a 4-year bachelor's program. Now it's a master's level program. So it would be a 6 years of education with a master's degree to become an athletic trainer. And then to become an educator, you kind of got to go get that doctorate. So when I got excited about teaching courses and educating, is I did go back to University of San Francisco and get my doctorate in education. So that was another 3 years.
Yeah, so for me, you know, I'd mentioned earlier, I had always had an interest in medicine, but I realized in college that that being a physician wasn't a good fit for me. I was a science major in college. I went down to UC San Diego, and then I started doing research at the time. So instead of, you know, practicing medicine as a physician, I decided that doing medical research was a better fit for me. And so I spent many years doing medical research. I did my PhD at UCSF doing medical research, and then I did a postdoctoral fellowship out in the Midwest in St. Louis for another 5 years doing medical research. So I came to teaching a little bit later after I had already kind of established a career as a researcher. I started teaching out in the Midwest. And then now part of my role at Sonoma State is I also run a research lab. And so I teach a lot, but I also have undergrads and graduate students at a research lab at Sonoma State there. So a lot of school. So probably another 10 years after I graduated college in school and training.
Great, thank you. I think it's a good time to wrap up, but we do have one more question. Actually, and then I'm going to ask one more quick question. But the question we have in the chat here is, can someone with a disability enter the medical field?
Yeah, you know, it does depend on a little bit what that disability is, but you know, in terms of access and trying to get some accommodations, schools all along the way are going to be receptive to that at some level. So having a disability is not an automatic exclusion from the medical field.
Yeah, and Dr. Winter, I assume that goes the same for kind of.
Yeah, we see the same thing for people that are going into the physical occupational therapy fields. Yes. Yeah, part of it is they have compassion. They understand where their patients are coming from, so that they make a very valuable member of that community.
Wonderful. I want to thank both of you for joining us. But as we wrap up, I have one more quick, like 30-second question, or a question that I hope you can answer in a good 30 seconds each. Is, can you leave these students here with one piece of advice from where they are right now in early high school and they're starting to explore careers? One piece of advice that you think would really help them as they continue forward through school and up to a career.
Go ahead, David.
Okay, I mean, I think Dr. Lin said it earlier, is the passion. Find out what you're passionate about. What is it that excites you? What is it that you know, you're going to look forward to going every day for the next 30 or 40 years to that job? And also think ahead. Think ahead of, you know, some people, emergency medicine and being an EMT and a paramedic, that's what excites them, and the rush of adrenaline. But do you see yourself doing that when you're 40 or 50 years old? You know, what other plans do you have? So I think you really have to pursue, you know, what you're passionate about and what you have talents for.
Yeah, my advice would be put a plan together, write it down in terms of set goals, right? Set short-term goals, set long-term goals, and write them down, because life is easier if you're working towards something. If you don't know what you want to do, that's okay, but pick something that you can at least work towards, because the key is it's okay to change your mind, right? Just because you make a decision now and you want to work towards being X doesn't mean you have to do it. But again, it's easier to work towards something than to feel like you're just treading water until you figure out what you want to do. I meet a lot of freshmen that all come in wanting to go to medical school, and many of them change their mind and they find something else they're more passionate about. Like Dr. Winter was saying, you'll get exposed to a lot of different things the longer you're in school, and the idea of something might be great, but you might find something else even more attractive to you as you go along in your education. So write down your goals, short-term goals, simply like, I want to do well in biology this year. Long-term goals, like, I want to go to such and such college. You know, even longer-term goals, and I want to have a career doing this. And that those goals can change, but it's always nice to have them in mind as you kind of, it helps you motivate because you see what you're working so hard for.
Great, thank you very much, both of you. I really appreciate you taking the time to help out the students. Ms. Moran, thank you so much for pulling the team together here, the class, to come and ask these wonderful questions.
Yeah. Thank you. Thank you so much for organizing this and reaching out to, I want to say, our career and college counselor, Jess Hazelwood. She's amazing. So, and I'm really proud of my students today. I thought they asked some great questions. So.
Yes, actually, very, very good questions. I would also say to anyone watching, though, this is the first activity of 5 throughout this month focused on health pathways and health careers. So I would encourage you to tune into some of the other ones. We've got ones about mental health careers, one focused on nursing, a panel with a nurse, a dentist, and a therapist, and one focused, very similar discussion, but with some folks from SRJC as well. So we have a lot going this month, and those can all be found at ctesonomacounty.org/virtual CCL. CCL stands for Career Connected Learning. So thank you, everyone. I really appreciate it, and have a wonderful day.